COVID-19 vaccine hesitancy. Understanding the reasons why are some people reluctant to roll up their sleeves, and what's wrong with wanting to be fully informed. Leading experts, pharmaceutical company reps, physicians, and patients talks about the latest news and science behind the race for a COVID-19 vaccine. To see videos about race to COVID-19 vaccine, see the link at the end of this video. This video brought to you by HealthyRN Ways channel that talks about the COVID-19 pandemic. Video posting every Monday, Wednesday and Friday. To see my other videos, see the link at the end card of this video. As more states open up COVID-19 vaccination to anyone age 16 and older, the federal government has pulled out all the stops, unleashing a full-force media blitz that includes a multi-million-dollar ad buy in both English and Spanish. It has enlisted groups including NASCAR and the NFL, the Catholic Health Association, American Farm Bureau, and American Medical Association to help deliver the message that vaccines are safe and effective. The goal is to combat hesitancy, which has dropped considerably but remains substantial among those most susceptible to contracting and possibly dying from the virus. This includes people who work in medical fields and long-term care facilities. As the Pew organization reported recently, only half of long-term caretakers are vaccinated against COVID-19. To find out why certain groups remain hesitant and what messages may work to overcome their reluctance. In order to beat the coronavirus, the vast majority of Americans have to get inoculated to reach herd immunity, which means you get a blanket of protection over the country and very little viral activity. We need 70 to 85% of the population to be vaccinated. The latest figures from CDC COVID data tracker show that nearly 1 in 4 American adults are now fully vaccinated, and more than 40% have received at least one shot. Among older people, 3/4 have now received at least one shot, and more than 55% of them are fully vaccinated. As more people get vaccinated, acceptance for the vaccination has grown. A poll conducted at the end of March 2021 found that the share of the population who want the vaccine has increased, while those who say they will wait and see, or don't want the vaccine, has shrunk. The percentage considered vaccine resistant dropped to about 37% in March from about 63% in December. While numbers are trending in the right direction, a significant percentage of Americans are still reluctant to get the shot. The Biden administration, however, is working to persuade these individuals to get inoculated. As part of the effort, the administration launched the COVID-19 Community Corps at the beginning of April. The Community Corps is a nationwide grassroots network of local entities people know and trust who can encourage others to get vaccinated. This effort is asking health professionals, scientists, community organizations, faith leaders, businesses, rural stakeholders, civil rights organizations, sports leagues and athletes, and Americans from all walks of life to become leaders within their own communities in order to help get friends, family, and neighbors immunized. Enthusiasm rising in Black communities. One group that has demonstrated a higher resistance to vaccination has been African Americans, although survey shows that enthusiasm has been on the rise among this population. This vaccine hesitancy stems from a distrust in medicine that has developed from a long history of racism in medicine. As a stark example of racism, deception, and abuse in medical research directed toward African Americans. Male participants in this research, which was conducted between 1932 and 1972, had been misled and not given all the facts necessary for true informed consent. They were never given adequate treatment for their disease, even when penicillin became the drug of choice for syphilis. Racism in healthcare continues to this day. Black newborns were more likely to die when looked after by white doctors. A Black physician detailed on Facebook the racist treatment she was receiving while hospitalized. She died of the coronavirus later that month. The racism in our healthcare system is real. On top of that, the African American communities have been marinating in misinformation and disinformation, the previous administration's constant stream of falsehood surrounding the virus as a major contributing factor. At one point in the not-too-distant past, the #1 source of disinformation was the White House. You don't overcome that overnight. The vaccine hesitancy may be eased by directly delivering information about the vaccine to people in their communities. The Health Advocates in Reach and Research Intervention aims to do just that. The primary goal of HARE is to create an infrastructure to engage barbershops and beauty salons as culturally relevant portals for health education and the delivery of public health and medical services in the community. We have to serve the people at the point of their need, then maybe they'll listen. We have to build trust. We're now bringing the message of COVID mitigation to Black barbershops and beauty salons through Zoom. Just as more African Americans seem to be inclined to get inoculated, we are dismayed by hurdles to vaccine access, many people who are unable to get appointments, and some scrambling to find extra doses that occasionally become available at drugstores, the melting of the ice, so to speak. But people need an easy way to get access. Getting more healthcare workers on board. While most healthcare workers appear to be getting their shots, a good number are still pushing back against vaccines for themselves. A survey released in March found that about 3 in 10 healthcare workers were unsure about getting vaccinated or not planning to do so. The survey revealed that vaccination rates are particularly low among healthcare workers who are Black, those in lower-paying jobs such as home health aides, and those with less education. The reason for resistance is multifactorial. Among nursing home workers in particular, there may be a sense of skepticism caused by the inadequate response from the federal government when the outbreak first began. Given what happened last spring with the severity of these COVID-19 outbreaks, staff feel like they did not get adequate PPE, personal protective equipment, or testing fast enough. There is an element of distrust. The decision to get vaccinated very much comes down to whether or not you trust or feel comfortable in the people who are recommending it. Because many of these healthcare workers are non-white minorities, their wariness is due to a history of racism in the healthcare system. It has observed how misinformation has gotten a toehold among some nursing home professionals. From meetings with workers around the country, we learned that many have been influenced by rumors that the vaccines have a microchip in them or that they cause infertility. The CDC says that there is currently no evidence that COVID-19 vaccines cause fertility problems. The two biggest concerns has discovered are that individuals think the vaccines have been developed too quickly and that they are uncertain of long-term consequences. We have tried to reassure people that all of the usual safety steps were taken when developing these vaccines. It's just that the normal safety steps and studies overlapped with production. Some people that in the long history of vaccines, it's extremely rare for any to have long-term side effects. The vaccine mandates are a good idea. It is believed there are better ways to motivate healthcare workers to get vaccines. These include finding frontline healthcare workers who are like them to talk about the vaccine, and making sure workers have reliable, trusted information, listening to people, understanding their concerns, and trying to give them good information to make their own decision, rather than trying to force people to get the shot, is probably the best strategy. This is a topic that we've heard more and more about lately, especially as the administration has announced a huge ad buy to combat this very issue. Let me just start by asking you, is this a real issue right now, especially since everybody still doesn't have access to the vaccine? How do we actually measure and know that there are still big pockets of hesitant Americans? There are a lot of things that we don't know. But here's what I do know from what I'm hearing in the community, right down at the local barbershop. And it's that being hesitant doesn't mean never. And being hesitant is like protection from what has happened to my community, Black people, over the years. Those jumps happen because we've been doing Zoom town halls, having conversations with communities, giving them the information they need to make informed decisions, not shaming them, not blaming them. Pew reported recently that just half of long-term caregivers are vaccinated against COVID, many reporting hesitancy in getting the shot. I'm glad you're here to explore this issue with us, because one group in particular that's been a bit surprising in their reluctance to get the vaccine is medical professionals. You've examined this area at length, based on your work in this sphere. It's complicated. I think it's probably multifactorial. I've been doing most of my work in the hospital, in emergency room, Given what all happened last spring with the severity of these COVID-19 outbreaks, staff did not feel like they had adequate PPE or testing fast enough. There is an element of distrust, a distrust of management. Having COVID-19 doesn't fully protect against reinfection. While a previous COVID-19 infection may help ward off an infection in the future, a new study finds that it doesn't offer full protection for everyone. Researchers found that around 10% of those who were previously infected with SARS-CoV-19 became reinfected with the virus. 48% of study participants who had not been previously infected developed new infections. The research confirms that young people who were previously infected can be infected again. The findings also show that people may not be aware that they're reinfected, and can potentially spread the infection to others. COVID-19 reinfection. The recruits went through several stages of testing over many weeks. They received antibody tests when they arrived at their Marine-supervised quarantine facility to establish whether they had previously been infected with COVID-19 and were also tested for a new SARS-CoV-2 infection at the beginning of the quarantine period, followed by tests at weeks 1 and 2 of the quarantine. After quarantine, those who did not have COVID-19 entered basic training and were tested for COVID-19 every 2 weeks, for 6 weeks. Those who tested positive during the study period were isolated and given additional testing, including antibody tests. The researchers analyzed the data and found that, in those recruits that had COVID-19 antibodies, those who became reinfected had lower antibody levels than those who did not become reinfected. It's also worth noting that most of the recruits who already had the virus had no symptoms, 84%, compared with 68% of asymptomatic cases in those who were infected for the first time. Previous COVID-19 infection does seem to offer some level of protection. Recruits who had COVID-19 in the past had about a fifth of the risk of being infected again compared to those who had never had the virus. If you've been infected with COVID-19 in the past, your best bet at protecting yourself from reinfection is getting vaccinated. It's also important you continue to follow safety guidelines, including wearing a mask and social distancing and hand washing whenever possible. Experts stress the importance of vaccination. The cells that remember the way to respond to the infection by COVID can decrease or even disappear over time. Each person's antibody response to a COVID-19 infection can also be variable. Getting a natural COVID-19 infection might not produce enough antibodies to protect from reinfection. The Centers for Disease Control and Prevention recommends that people with a previous COVID-19 infection get vaccinated against the virus. Vaccine presents to the immune system a protein from COVID so that the immune system can learn to respond to it, but it does not have the virus components that can decrease the immune response during a real infection. Vaccination has the potential to be more effective than natural infection in preventing future infection. The vaccines also produce a strong antibody response, particularly the vaccines that use mRNA technology. Overall, it is important to get vaccinated even if you have been previously infected. Having a past COVID-19 infection may not fully protect you from future infections. Even young, healthy people can get reinfected with COVID-19. Getting vaccinated against the virus should offer a more robust level of protection. Please like, share and subscribe to my channel. Thank you for watching. See you on my next videos. Ma salama.